question. That is basically the C peptide is in a better compared to fasting insulin level. The reason is that insulin has a very short half-life. If you in the measure in the blood, it is having a short half-life. So maybe aerogenous when we do the test. C peptide has a longer half-life. Insulin may be affected sometimes the external factors. I don't know whether patient is taking something else. C peptide is in a totally endogenously secreted. It will not be external. Like sometimes
C peptide is better for the childhood,
Any
and
group.
fasting insulin is better for adult.
fasting insulin for what you are talking about. If you are measuring the insulin resistance, then we have the HOMA A and HOMA B component. For that, you require the insulin. But for diagnosis, whether the type 2 diabetic patient will having the LADA or pancreatic diabetes sometime, so you require a C peptide, even a type 2 diabetes. Because sometimes even diagnosed in lean type 2 diabetes, these people are basically the LADA patient, or these are the pancreatic, like young 40-year lean person is coming to you. Sometimes here and there started so many medicine is a typical pancreatic diabetes. So you require a C peptide to diagnosis because he required insulin.
But sir, before HbA1c, insulin goes high, more than 6. So in pre-diabetic stage, we can judge that he will go into diabetes. If you calculate insulin. Fasting insulin अपने आप कराने का रिवाज नहीं है. बाकी fasting insulin better than HbA1c. अमेरिकन एकेडमी
एक्चुअली सर प्री डायबिटिक का मतलब ही यही हुआ है कि इंसुलिन रेजिस्टेंस, और इंसुलिन रेजिस्टेंस अगर हम उसका फिजियोलॉजी देखें तो इनिशियल स्टेज में इंसुलिन रेजिस्टेंस है, आपका बॉडी इंसुलिन ज्यादा ही बनाए. जैसे एक प्री डायबिटिक पेशेंट में हाइपोग्लाइसीमिया होता है. क्यों? क्योंकि अगर मील पैटर्न बहुत लंबा हो गया आपका, तो उसमें क्या होता है, जैसे इंसुलिन रेजिस्टेंस है आपका बॉडी इंसुलिन ज्यादा बना रहा है फिजियोलॉजिकली. आपने 5-6 घंटे नहीं खाया, आपकी बॉडी में इंसुलिन था, आपका हाइपोग्लाइसीमिया. So it is a proven factor. Pre-diabetic patient will having the high level of insulin level. So you have to reduce the insulin resistance, so insulin level will come down in that patient.
So, so I have a question for you. So because we see we have so many trauma patients.
Yeah.
So how do you rate this thing, HbA1c in a trauma patient?
Very good question. Actually, I am coming to that point. Because sometimes
GDM diagnosis भी
हाँ, एक्चुअली मैडम पहले जैसे सर्जरी, अर्जेंट सर्जरी है, सब कुछ है, तो हमको HbA1c को साइड में रखना, मैं ये मानता हूँ. आप करंट ब्लड शुगर लेवल देखो. अर्जेंट सर्जरी कभी भी डेफर नहीं करनी, बिकॉज नाउ व्हाट विल बी द मोस्ट प्रॉब्ली दिस पेशेंट विल गो टू आइदर एन IV इंसुलिन, subcutaneous insulin, because it is if sugar is level is very high. So I think urgent surgery has to be carried out, whatever. And you rightly said the trauma, तो हमें करना ही, क्योंकि अब जो इंसुलिन है ना, आगे अगर हमने 2 दिन में भी इसका इंसुलिन शुगर का लेवल कंट्रोल कर दिया, जो टिश्यू रेजिस्टेंस है इन्फेक्शन के लिए वगैरह, वो कंट्रोल हो जाए. सो नेवर पोस्टपोन. आई थिंक 12-16 है. I will be start with IV insulin right now.
Patients, once they are admitted in the ward, we come to know that this is a diabetic patient.
Yeah.
We put him on insulin, or the patient is already on insulin.
Yeah.
His HbA1c may be 10 or 9.
Yeah.
And his routine blood sugar is somewhere around less than 150 or less than 200. But because HbA1c is so high.
इस कंडीशन में तो सर HbA1c को हमको, क्योंकि HbA1c 2 चीज पे डिपेंड करता है. हाउ हाई शुगर इज देयर. हमारे पास काफी बार पेशेंट आते हैं 400-500 शुगर, 8-10 HbA1c है, एंड हाउ लॉन्ग HbA1c was there on the higher side. Still HbA1c will be on the higher side. Suppose you tell you are like patient having the fasting of 150-160, post meal is 220. अब नॉर्मली HbA1c 8 या 9 के आसपास, लेकिन उसका 11 आ रहा है, क्योंकि मे भी पिछले 4 महीनों से उसका शुगर बढ़ा रहा है. So that is because the
cut off point wherein yes, you can think that if HbA1c is 10 and if routine sugar is,
I think there is no surgical guidelines and no endocrine guidelines where HbA1c used as a judge to decide the surgery.
So we don't have to consider HbA1c.
That is safe.
So we are putting an implant inside.
Yeah.
So the
So you like we will start the IV insulin. IV इंसुलिन भले उसका शुगर 200, 150, 250 रह रहा है, IV इंसुलिन पे भी
400
400